time to show you now what it looks like. Ready? The new smile. It's been many months in the waiting. There you go. So this is just a setup showing all the different records we have taken either before or during the actual smile makeover process. All these things will now get sent to the laboratory so that the ceramics technician can do his work and make the porcelain restorations. So this is showing you the close-up detail of the honeycomb putty and wash technique impression. We've got very good detail marginally everywhere, no air blows at all. We've got no drags at the back because I syringed the material into the putty, which was good. So that's a very accurate impression, and I've been using these for now nearly 10 years, and really I can swear by every time I get precise records like this. This is the Dana jig for the face bow record that we took. So the patients, this was to the patient's right, the fork. The number 1 and 2 were facing us, and I'd locked number 1 first, then I'd locked number 2. And you just want a very thin imprint. You don't need very deep indentations in the composition. So that's the perfect record for the face bow. So here it's just a picture of the wax ups. My technician in this case has used blue wax, just for contrast reasons. Very good occlusal shape and carving, aesthetically and functionally correct. And by having superb wax ups made my life clinically really very easy. When I was doing the temporaries, you saw the flash was absolutely minimum and the finishing didn't take much time at all. This is just a pre-op upper model, and I often just make a few markings and things on there which helps me for the planning before I'm actually doing the case live. So here I've just indicated where I was doing the fiber post, where the veneers are going to be, where the bridge is. It just helps me on the day when I actually do the actual procedure. This is the lower articulated model. It's always important to check you got the molars all the way to the back and no blips or air blows. It looks all very accurate, that's why I didn't need to take any other impressions today for the lower. These are my definitive interocclusal records. They were taken in centric occlusion. I used O-bite, and these will make the technician's life very easy to articulate accurately. This is the stick bite record, which was placed in between the patient's teeth, and we put the bender brush in there. We've also taken digital photographs of the face whilst I was in place, and this ensures we get a nice horizontal plane to the smile, and the incisor ledges are not canted in any way, which is really important, especially in this case because there are multiple teeth missing and crowns anteriorly. These are my Luxabite interocclusal records as a second bite registration, just to be sure. So we've got 3 sections, left, right and anterior. And so very good idea is just to get your nurse to mark, or you yourself, mark it L and R. It just helps the technician orientate, and when you adjust them to put it on the between the models to articulate it. This is the correctly trimmed prep guide, which was simply made with a little piece of putty, and this was made from the wax ups, and it's invaluable in the smile makeover technique, just to make sure there's adequate space for the technician and all the tooth preparations have been done perfectly.